Hello and welcome to our live telephone town hall meeting with the 7th Congressional District of New Jersey. Thanks for being on. There's just a couple of you on right now. Thank you for being on our inbound participant line and joining us early for this live teletown hall with Congressman Tom Malinowski. Again, we're dialing out right now to the 7th Congressional District of New Jersey. We appreciate you being on this live teletown hall with us. We'll get started in just a few seconds here, and in the meantime, I'll tell you how you can participate in our call today. So again, we're dialing out to your neighbors in the 7th Congressional District. For those of you who are on, you can press 0 at any time to submit a question. We'll be getting to Q&A in a few minutes here. We'll hear some updates from Representative Malinowski. We've also got Mike Delamater he's the Deputy Chief of Staff in the Intergovernmental Affairs Office of the Governor of the State of New Jersey. We'll hear some updates from him as well. And then we'll be going right into Q&A with your questions really directing the flow of the conversation. So as you're listening to our opening remarks from the Congressman, be thinking about questions you'd like to ask him in Q&A. As soon as you have a question you'd like to submit, press 0 on your phone, submit that question to an operator, and then you'll have the opportunity to ask your question live. But if you're not comfortable asking it live, that's fine. Still press 0, still submit your question to an operator, and then you can let your operator know if you want the moderator to read your question over the air instead, which is fine. Just let your operator know, and I'm happy to read it if you're not comfortable going live. Let me go through this intro one more time, then I'll turn it over to Representative Malinowski to get us started. Again, welcome to this live teletown hall with the 7th Congressional District of New Jersey. Congressman Malinowski will give some opening remarks and update constituents on the response to the COVID-19 pandemic. As we are listening to his updates, be thinking about questions for Q&A. You can press 0 at any time to submit those questions. After we hear from the Congressman, we'll hear some updates on the state and federal response to COVID-19 from Mike Delamater, Deputy Chief of Staff for the Governor's Intergovernmental Affairs Office. Then we'll start taking questions from you folks in our live audience. So some of you are already pressing 0 to submit questions. Thank you so much. We'll be getting to Q&A in about 10 minutes here after we hear some updates from the Congressman and his featured guests. Then as soon as we're done with that, we'll get to Q&A. We'll spend most of our hour on Q&A. So again, 0 with questions. One more thing, if you'd like to get email updates from Congressman Malinowski moving forward, we'd love to be able to keep you updated with accurate information quickly. Best way we can do that is via email, so press 7 if you'd like to give your email email address for updates. We'll gladly get you those updates moving forward electronically so that you can have accurate information quickly. So once again, 7, you get email updates from your congressman. And with that, we'll go ahead and get started. Again, 0 for questions. 7, give us your email address to get email updates. And let's go ahead and kick it over to your representative to the U.S. Congress and New Jersey's 7th Congressional District Representative, Tom Malinowski. Go ahead, please, Representative.
Thank you so much, and thank you, everybody, for joining us for a conversation tonight about where we are in the fight against COVID-19. I think it's very clear that we are doing a lot better in New Jersey in comparison to where we were a few weeks ago. The rate of transmission in our state is down significantly. Hospital admissions are down. The number of people on ventilators and using intensive care beds, all significantly down. These are great signs, and it's because of all of us. It's because all of us decided to make sacrifices, to stay home, to shut down businesses in many cases for the sake of protecting our loved ones and our neighbors and our communities. And I want to thank everybody on this call for the sacrifices you have made to save lives in the last couple of months. Of course, we know the cost has been incredibly high. Sometimes I hear people trivializing it, comparing it to, people dying from car accidents and things that are unavoidable in our society. Well, we have lost thus far in New Jersey this year 177 people to car accidents, 177. We've lost more than 11,000 people to coronavirus, and that's just the official number. The true number is almost certainly higher, and it would be much, much higher if not for the social distancing and the lockdowns that we've all taken part in. So that is something that should make us very, very sober and mindful about the road ahead. We're still getting hundreds of new cases of coronavirus a day, even though things are a lot better than they were. So let's be mindful as we gradually begin this path of reopening our state and returning to our normal lives. And as we do what's necessary, my job, my focus is going to continue to be on getting New Jersey, all of our communities, and all of our people the relief that we need to make it possible to survive this crisis economically. We've made some progress there too. We've got the small business relief program up and running now. Over 100,000 small businesses in New Jersey have gotten help in the second round of the funding for that program compared to just 30,000 in the first round. My staff is working around the clock to try to help people get their unemployment checks. And that system, it's not perfect yet, but it is working better than it was before. And just last week, Congress passed our latest piece of coronavirus legislation, the HEROES Act. The most important piece of it from my point of view, and the part that I fought for the hardest, was to get aid to our state, our county, our local governments to try to make up for the revenues that they're losing because the economy has been shut down. We don't want them to have to lay off our firefighters, our cops, our teachers, to reduce basic services or to raise taxes to be able to maintain those services. We need help from the federal government, and the House of Representatives just agreed to provide very generous help. We're going to have to fight now to get that through the United States Senate and hopefully to the president's desk to sign it into law. All of this is obviously very expensive, but it's worth it. It's worth it to save lives. It's worth it to get our economy sustainably back on track. I just want to do this once. I don't want to have to come back in the fall if we've done it halfway. I don't want to have to come back and have to do it again, to shut down the economy again, to pay the price that we've paid this spring all over again. And that's all the more reason, I think, to be careful and mindful as we relax these restrictions and transition towards reopening. So with that, I want to turn it over to Mike Delameter, who is Governor Murphy's Deputy Chief of Staff, somebody I've worked with very, very closely since the start of this crisis, and somebody who can brief us all this evening on the governor's latest decisions, latest executive order with regards to the gradual reopening of our state. And so, Mike, say a few words about what's going on. Help us understand what's open, what's not, and what we can expect over the next weeks and months.
Thank you, Congressman. Really appreciate you having me on tonight. I'll just go over a couple of things the governor announced today to reiterate, and then kind of go through what you went through in a little more detail with the hospitalizations, then just try to go through what we see kind of in the next round of openings. So today the governor announced that school districts will be able by July 6th to have outdoor graduations. That was something that has been asked for the past couple of weeks, and we found a way to do. There's a whole process with that, with the individual school district having to report that into the Department of Education, higher education, depending on if it's a university or not. And so we feel comfortable that come July 6th, those will be able to occur. Secondly, we allowed, the governor allowed on Friday actually, but announced it today, that professional sports teams will be able to go back to practice after conversations with those various leagues. That does not pertain to youth sports yet, though it's a good sign that that could be coming in the future. And then lastly, I really have to give credit to Congressman Malinowski, that's played a big role, that the Federal Railroad Administration awarded $91.5 million to Amtrak and New Jersey Transit to get the replacement of the Portal Bridge moving forward. And Congressman Malinowski, you were a leader in that, and we've been fighting for that for a while now. So that was all hands-on-deck approach, but you were certainly at the forefront on that. When it comes to hospitalizations, I think it's important to put it into context. Today, the number of patients that are hospitalized for COVID-19 was at about 2,500, which was down about 1,700 over the past 2 weeks, which is just an incredible improvement. Critical intensive care patients down to 723, which is 500 patients lower than 2 weeks ago. Ventilator use at 522 statewide, down 400 from 2 weeks ago. And new hospitalizations Net new hospitalizations yesterday were 0, but obviously some data is out on that. When it comes to opening back up the economy, those numbers are the most important numbers to look at. And just as a benchmark, pre-COVID, roughly on the average every day, hospitalizations for all ailments were anywhere between 2,000 and 2,500 a day statewide. So now we've gotten to that level, but that's just COVID patients, so it doesn't mean we're out of the woods yet. And today, an action the governor took about 2 weeks ago, elective surgeries were allowed to continue starting today. So as those happen and COVID starts decreasing, we're going to see a little bit of total hospitalizations overall, while COVID lessens and elective surgeries increase, sort of maintain, and we're able to kind of get a handle on our hospital system, which is in sight. When it comes to the phases of opening, we're pretty much at the end or nearing the end of phase 1. Phase 2, as a general matter, and I can't really speak to specifics on this, but just to give everyone an idea, phase 2 is personal care. So that would be a hair salon, nail salon, barber shops, gyms, fitness centers, things of that nature. Outdoor dining would be included in that. Limited capacity indoor retail shopping. Municipal pools has been sort of a hot topic. Summer camps, things of that nature where people are congregating in some larger groups over the 25 that are allowed and have been allowed over the weekend. Overall, the governor announced today that Memorial Day, and the weather probably helped a little bit, was overall pretty calm and pretty compliant across the state. So as we look to move forward with this, I think we're ready sooner rather than later to move into that phase 2. That doesn't bring everything back to normal, but it shows a really solid amount of progress as we move forward in this and try to get back to a new normal. That being said, we're not going to really be comfortable, and that consumer confidence isn't really going to be back, in our opinion, until we have some type of guaranteed therapeutic or, potentially, a vaccine or something of that nature. So that's kind of where we're at. As a state, we continue to try to move forward, work tremendously well with Congressman Malinowski and the rest of the federal delegation. The two things we really need, just in closing, the two things the governor has really been asking for the last month: direct federal support, which the congressman and many of his colleagues are fighting for down in Washington, to not just the state, but counties and municipalities. And then also state legislators. The state legislature needs to give our administration here at the state level the ability to go out and bond if we need to in the absence of any federal aid. So it's really a two-front battle to make sure, to the congressman's point, that we have the ability to maintain our law enforcement, to maintain our teachers, maintain our first responders, many, if not all of whom have been on the front lines. Healthcare workers, for example, have been on the front lines during this fight and have put their lives on the line. And just making sure we can bring those people back and give them a sense of financial awareness, and at the same time being able to make our small businesses whole so that they don't lose their business after doing what was appropriate for the public health. So with that, I'll turn it back over to you, Congressman. Thanks for having me.
Thank you so much, Mike. Moderator, why don't we take some questions?
Happy to do so. Thank you again, Congressman. And for those of you who have just joined us, thank you for being on. We're on with your Congressman, Representative Tom Malinowski, representing you in New Jersey's 7th Congressional District. We also have Mike Delamater, the Deputy Chief of Staff at the Governor's Intergovernmental Affairs Office. If you have a question, you can press 0. We'll be taking them live, but you can also let your operator know if you want me to read your question instead of bringing you live, and I'm happy to do that. And if you would like to get email updates from the Congressman's office, please press 7. Press 7 on your phone to get email updates, and we'll get your email and keep you better updated electronically in the future. Let's get our first question. This one's coming live from Christine. It looks like a good one from Mike. Hey, Christine, you're live with us. Go ahead with your question.
Hi, good evening. Thank you for hosting this again. I've been part of each one of them. I heard that Governor Cuomo of New York has passed some sort of law or some sort of recommendation that healthcare workers at long-term facilities are now going to be tested for COVID twice a week. unfortunately, last week I had to place my mother in a facility in New Jersey. She fell and broke her hip. She's receiving excellent care. They are, doing everything possible. I'm just wondering if we are going to pass that same sort of requirement in New Jersey where anybody working in a long-term health facility would be tested twice a week.
So I have kind of a mixed answer for you. We're definitely at a place where we're going to make sure that everybody that works at a facility and is in a facility is tested. Twice a week, I don't have much visibility into that as we speak today. I just want to take this opportunity, a short time here, to kind of address what we are doing in the long-term care facilities as well. A lot has been made about them. There are an inordinate amount of positives, an inordinate amount of deaths. Obviously, age plays into that, comorbidities and things of that nature. I got confirmed today, actually, that every long-term care facility has submitted, as well as assisted living facilities, has submitted a compliance plan. I have 2 calls to round out the week with both municipalities and counties, as well as long-term care facilities, on contact tracing and making sure that we're contact tracing the staff there, so that if anyone falls ill, that we can trace them back. We required a while ago, some of the steps we took, requiring long-term care facilities to revisit infection prevention response plans, which I just mentioned, restricting visitation early on, back in March, implementing active screenings of patients, advising people who enter the facility to monitor for fever, creating separate wings and separating the asymptomatic from the symptomatic. So we understand the governor has mentioned this multiple times, that there are bad operators there. We are trying to take matters into our own hands as far as testing goes, and contact tracing, which is arguably just as important, in order to not just protect the patients that are in the long-term care facilities, but also the folks that work there. As far as 2 times a week, I will bring that up internally here, but I know for sure we will be testing everybody that works at the long-term care facilities in addition to the patients.
Thanks again, Mike. Much appreciated. Thank you for your question, Christine. And thanks for being a part of all of our teletown halls today. We appreciate you. We'll get our next one up right here from Gail. Looks like another good one for you, Mike. Hey, Gail from Clark. You're live on the line. And it looks like Gail wants me to read her question. So she says, New York is encouraging everyone to get tested. Where is New Jersey on this? Mike?
So we have 2 or 3 weeks ago, the governor announced that we are testing and advocating our county sites to test for asymptomatic patients. Part of what I mentioned in the previous question as far as having calls about contact tracing, if we have testing and our spot positivity has plummeted, I think about a month ago, for every person that was tested, 40% had come back positive because we were testing just symptomatic patients. Over the past 2 or 3 weeks, we've been testing asymptomatic folks, and that has plummeted probably at least in half. In some cases, we're in the single digits on spot positivity. For those of you that aren't aware of what spot positivity is, when we go and test somewhere, it's at that given time how many folks are coming back positive. So we have access to testing for anybody that wants it, and in a serious way. If you go covid19.nj.gov, any public testing site, you can get knowledge of any public testing site. We have partners with Rite Aid, Walmart, and CVS in order for them to do testing. I think in your district, Congressman, Walmart has testing available a few days a week in Flemington. So we are trying to expand testing and contact tracing as fast as humanly possible. My hope is at the beginning of next week we'll have some more news on the expansion of contact tracing. That might be a little bit hopeful, but that's the goal. And so, as far as testing goes, asymptomatic, symptomatic, whatever your situation is personally, if you want to get tested, you should be able to get tested. And to the extent you need to know based upon where you live, where the closest testing site is, more than happy if you want to work through the Congressman's office for me to help answer that question.
Yeah, let me jump in there too.
Yeah, go ahead, Congress.
I think, this question about testing is the most important question.
Mm-hmm.
We're all wondering, when will things reopen?
Mm-hmm.
But the most important question is, what are we doing to make it safe to reopen? And the one thing that is most important in making things safe is getting us to a point where everybody can get a test. If you want to go back to school, you can get a test. If you want to go back to work, you can get a test, and then get one again to make sure that everything is safe with the contact tracing. So if someone tests positive, we can figure out who might have been in close contact with that person so that they can be encouraged to get a test. We're getting there. We're not there yet. We have to be very honest about that. We have some drive-through facilities in our district that have mostly been testing people with symptoms and now are beginning to test people who don't have them. Mike mentioned Walmart in Flemington. That's fantastic, but it's not enough. We are getting testing into local pharmacies, the Rite Aids, the CVSs. That's absolutely critical. We want this to be easy. We want this to be widely available, as easy as getting a flu test. And, once we're there, then I think we can talk a little bit more confidently about reopening everything. And I've been working closely with the governor's office to try to make sure we get New Jersey the resources needed for that widespread testing.
Yep.
The PPE and the test kits and all of the equipment that's needed to be able to realize that goal.
Yeah, we're thank you, Congressman, for clarification. We're not to the point where if we had a mad rush of demand for tests that we could test everybody, but as of right now, there is testing open to asymptomatic individuals. So on a macro level, asymptomatic individuals can be tested. It's just a matter of where, and I know not all the county sites are doing that as of right now on the public side, but on the private side, we're starting to ramp up. And so my offer still stands to the extent that you need to get tested. Obviously, this is Congressman Malinowski's town hall, so want to reach out to his office to work with me or my team. More than happy to try to make sure that if you want to get tested, that you have access to it as of right now, and then that's only going to expand going forward with the Congressman's help and, as we move forward with the contact tracing and the testing.
Appreciate the answers. Thank you so much. And Alex, thank you very much for your question. Appreciate you submitting that. We've got our next one coming here from Erica. Erica is live on the line from Warren. Looks like you've got a good question for Mike as well. Erica, go ahead.
Yes, hi. My question is in regards to the DMV. I'm just wondering, there's a lot of pressing issues right now. However, so many places have figured out how to open social distance safely, and I know that there's a lot of people waiting to go to the DMV for important reasons, and there's plenty of 17-year-olds that are dying to get their license, and they also need to, go to their summer jobs or help their parents now with childcare as they're going back to work, and they're going to have thousands and thousands and thousands and thousands of 17-year-olds, and I haven't heard a word about a plan, no word about when they're opening, and it's just a little bit frustrating because we can go to the beach, but, we can't get the DMV to open. So I'm just really wondering if there is a plan at all.
Yep. Great question. We are trying to open the motor vehicle stations as soon as possible. There are some challenges, and to your point, I hear the frustration in your voice. We, as far as being able to give appointments for driver's license tests, that has not been fully worked out yet. So I'm not gonna be dishonest with you on the phone here, but we are working to get motor vehicles up maybe as soon as a week or two from now. As far as opening, what that will look like, I don't really have solidly in front of me, but we are having internal conversations about that, to the point where you would like to hear a plan as soon as possible. Noted. I'll bring that to the chief and the governor, and we have been having internal discussions about this for 2 to 3 weeks, to the point in Middlesex County, which I don't think is part of this district, they were using some of our closed motor vehicles as testing site locations, and we have already told them that they have to vacate. So I hope that answer was sufficient enough.
Thank you. Appreciate that, Mike. Thank you, Erica. Appreciate your question. And we'll get our next one coming up live from Jody in Westfield. Hey, Jody in Westfield, you're live with Congressman Malinowski, looks like you've got a good question for Mike as well. Go ahead.
I do, and I want to say thank you for everything that you and your team have been doing. You guys are just incredible there. So my question is, does anyone have any idea, because you cannot get there hasn't been an update on the unemployment website as far as procedures go, so we have no clue, even after waiting, once unemployment starts coming through, how long is it going to take to get all of the back weeks? You know, they have you certified for like 6 to 8 weeks when it's finally your turn to get it, and then they disperse, for the current week. So for those of us that are waiting for 6 or 8 weeks worth of back unemployment, does anyone have any idea how that's going to work?
To answer your question in a little bit of a broader context, I also oversee, as well as kind of being in charge of communications with our elected officials at every level of government, I also oversee the Office of Constituent Relations, which is sort of, if you're a constituent like all of those on the phone and you call the governor's office, you go to the Office of Constituent Relations. And every day for the last 2 weeks, I've taken folks that have been waiting the longest and trying to get them directly to the Labor Commissioner, who I actually just missed a call from. So, and trying to make sure that those folks that have been waiting the longest are able to get it. That being said, there's only so much capacity with the incredible demand of the public at this time to get to them in a reasonable amount of time. But every time we solve one, there's another week that goes by, let's say, and then more people get added onto that backlog. So they are clearing the backlog as much as possible. The administration here at the state level has invested in hundreds, if not thousands, of laptops and more people on the phones, expanding hours for people to call. And that being said, it's an all-hands-on-deck approach. I have my entire team taking incoming from folks like Congressman Malinowski and members of the delegation, or mayors and county elected officials that have folks that come to them that, quite frankly, have gone without any sort of income for, at times, 6 to 8 weeks. It's important to note also in a broader context that there is not a state in this country, no matter how hard they've been hit by this or how light they've been hit by this to this point, that is not dealing with this problem. That being said, it's not an excuse. We have to do better, but we are doing everything possible to get as many people the money that they deserve, and even if they go back to work in the coming weeks, still getting them that money that they're entitled to for the last 2, maybe more months. So we are doing everything we can to relieve that backlog. I think we relieved a backlog of 140,000, but by doing that, created a backlog of folks that probably weren't waiting as long. So I just ask, and this is a big ask, but I just ask anyone who is waiting for their unemployment, just try to. I know I'm trying your patience, but just try to keep being patient. We are working on it. It's an all-hands-on-deck approach. It's certainly something that's very, very important to the governor to make sure that folks that have been unemployed due to this crisis, due to this virus, are made whole and are given what they are entitled to. Some people, by the way, have never taken a penny from state government in their life, and this is their first experience. And certainly, it's very important to us, for all people, to be able to get the benefits. They weren't laid off of their job or unemployed through any fault of their own, and they deserve to get that money. So we're working our damnedest to try to get it done.
Thanks again, Mike. And thank you, Jody. Appreciate you being on. We've got lots of good questions coming in here, so thank you, everybody who's submitting those. Let's get a couple in a row here for the Congressman. Congressman, we've got Joe in Cranford here for you. Joe, you're live. Go ahead.
Yeah, hi. I know you were speaking about, or the government was speaking about needing, getting extra money from the federal government for the so that you don't have to lay off teachers and firemen and whatnot. And mine's kind of a two-parter. This one question isn't that big of a deal, but if teachers are almost finished with working, will they be able to collect unemployment? That's just something that I thought about while I was sitting here, because usually I know teachers can't collect over the summer because they're technically working, or however that works. But my actual question is, the real question I'm asking about is, I'm wondering why I see stuff in the news and on social media about the governor looking to give money to illegal immigrants, and I'm wondering why if we can't afford to pay our firemen and our police officers and teachers, why there should be money given to people that, for the most part, don't contribute to, the same way that residents, legal residents, contribute.
I'm happy to take both of those, and thanks for the question. Starting with your second question on undocumented immigrants, it's a little known fact, but they actually do pay a lot of taxes and get no benefits back. And, that's tough, but it is fair. And I happen to agree that we should not be providing federal benefits, whether stimulus checks or Medicaid or SNAP payments to undocumented migrants, and we don't. That's the law. They don't get any of that, even though many of them pay Social Security taxes and income tax to stay on the right side of the law in that way. So that's where we are as far as any kind of federal program, and that's the way it's likely to stay. On your first question, look, you're right that if we don't provide for a way for people to stay employed, whether it's a teacher, a firefighter, a police officer, public works employee, they're going to go on unemployment. And think about what that means. It means we're still paying them. We're just paying them through the unemployment system. We're paying them not to work. We're paying them not to teach our kids. We're paying them not to save our lives, not to put out fires. What we're trying to do here with the HEROES Act that we passed last week in the Congress is to spend the money, because we're going to have to spend it, to keep them on the job by making the state whole, by making our counties, by making our local municipalities whole at a moment when they're not getting a lot of revenue in because businesses are shut down, because the economy is shut down. So that's where I think we need to focus. That's what I've been working on. That's what the House of Representatives has agreed to do. We got to get agreement from the Senate and ultimately the President to make it happen.
Thank
and
you.
thank you so much for the question.
I appreciate your questions, Joe. Thanks for participating tonight. We've got this one coming, Congressman, from Alex in Short Hills. He's asked me to read it. He wants to know, what are we doing on infrastructure moving forward? Should I take that one on, please?
Yeah, sure. Well, we have some good news today after a lot of pressure on the administration, a lot of advocacy from me and other members of our congressional delegation. We finally got the first money in to start what we've been calling the Gateway Project. The first part of the Gateway Project, which is all the stuff that needs to be fixed to keep our trains moving under the Hudson River from New Jersey to New York. The first piece of it is something called the Portal Bridge. That bridge is 110 years old. It has been the number one source of delays for New Jersey Transit over the last few years, even more than the Hudson Tunnel. Desperately needs to be replaced. We got the money starting to come in today, so work should begin relatively soon. I'm still fighting really hard for the money for the Hudson Tunnel. That's the next step. We're going to win that fight. It's taken longer than it should, but I've absolute confidence we're going to win that fight as well, and I'm not going to relent until we do. And then more broadly on infrastructure, right now, you've heard a lot about Congress passing stimulus bills. We haven't really passed stimulus bills. What we've been doing is keeping the American economy on life support so that we can get through this period of social distancing. The next stage, many of us believe, including me, we need a major recovery bill, a major economic stimulus bill, and the foundation of that should be a big investment in infrastructure. The House has a plan that we've put forward. We're going to pass that relatively soon. President Trump has also tweeted a couple of times that he agrees that this is the way to avoid an economic depression coming out of the coronavirus crisis. So we think that we can work with him on this. Even if we don't agree 100%, we can get to common ground. And that's my number one priority for the second half of the year, getting a major infrastructure investment passed through the Congress and to the President.
Thank you again, Congressman. And thank you, Alex. Appreciate your question. Leah's also asked me to read her question from Cranford, and she's asking, she filed for pandemic unemployment assistance and wondering, does PUA get the additional $600 a week? Congressman?
Yes. Very simple answer. Yes, it includes the additional $600 a week, and it will be backdated to, if you qualify, it'll be backdated to the day that you filed.
Got it. And Mike, did you have anything you wanted to add on that? Leah's question was just about PUA.
No, Congressman, I think, answered that appropriately.
Great. All right, let's get our next one up here from Julia, who's from New Providence, asking me to read this one. She wants to know, what is the cost of testing to individuals, and what is its coverage by health insurance? Which one of you would be better to take that one on, from Julia in New Providence?
I mean, I can just give you the basic principle, and that is, it is covered. It should be covered by your insurance, whatever insurance you have, certainly covered by Medicaid, Medicare, and if you don't have insurance, Congress has said that it will still be free. We will figure out how to pay for it so that you are not charged. If you feel you need to be tested, please get tested. And it's on us to make it easier for you to get tested by adding to all the opportunities to do so, as we were discussing earlier in the call. Mike, do you want to add anything to that from the state perspective?
Yeah, I think that's appropriate for the individual. For the state, it costs anywhere from $50 to $100 a test on the state, but we share the same answer that the Congressman has, that no individual should pay to get tested. Testing should be free for everybody for this virus, and so at the state level, I think Medicaid and Medicare cover it up to $100 or maybe a little bit more, $100 or maybe a little bit more than that. The Congressman's right. All insurance carriers and Medicare and Medicaid should be covering that, and it's our position too that nobody should be paying to get tested.
Thank you again. Appreciate that answer. Thanks for the question. And we'll move right along to Monica, who's coming live from Phillipsburg. Hey, Monica, thanks so much for waiting. What's your question?
Oh, hi, and thank you for doing this. While you were talking about testing, I was thinking about this. I am a children's librarian, and I was wondering when or what part of the phase might we be going back and what it would look like as far as interacting with people. And then would the state, possibly cover us, since we're going to be interacting with citizens of the state?
Yep. Great question. I get questions on libraries at least once a day. Libraries are mainly in the phase 2 portion, in conjunction with everything I mentioned at the top of the call. There have been some questions on curbside library pickup, having books outside. Obviously, the concern with books is if in a library you have the ability to browse, you can take a book, put it back, and there's no way to kind of trace who touched a book. What safeguards will be in place? We are working through all of those situations, but the libraries are likely in some form of going to a library is likely in the phase 2 section. So probably at some point in the month of June, I would say.
Thanks so much. Monica, that question good answer for you?
Yes, thank you.
Sure thing. Thank you, Monica. Let's get our next one up here from Aggie in Raritan. Aggie, you're live.
Yes,
Thanks for waiting. What's your question?
Thank you, Congressman, for taking out the time to answer these questions for us. Do you have a tentative date for our Somerville office opening for the Department of Labor and Employment?
I think that's probably
Mike,
a question for me. So I actually asked this question today. When can we expect those offices statewide to open? Have not gotten an answer yet, but to the extent I get an answer in the next day or two, I will report that back into the Congressman's team so that he can follow up with an answer for you. Don't have an answer right now, though.
Appreciate it. Thanks, Mike. Thank you, Aggie. Let's get one here from Joseph. And a quick reminder, we got about 20 minutes left in our town hall today, so thank you everybody who's submitting questions. We'll ask you to just keep it to one question per person moving so forward so we can get as many as we can. Joseph in Phillipsburg, you're live on the line. What's your question for the Congressman?
Yeah, I was wondering about the tax relief in a sense of homeowners that are sitting there paying for taxes on schooling and stuff like that. The fact that we haven't been in school for, well, with summer, it's going to be 6 months, and we're not guaranteed on whether we're going to open schools for August and September, but I was more wondering about, like, the mortgage owners, the homeowners and stuff like that are going to, like, suffer through this throughout America, really, and be able to find out the fact matter that, like, our $2 million school and stuff is not being used, since we have a decent hospital around this area that will help with coronavirus and has enough room and such. I don't know of anybody sitting there working in the school to be able to help relief kind of wise to, have any use to that school and such. And for the fact that my kid also did homeschool as it was in his own prerogative to sit there and do it at home. They have a program that started. This is the second year now. And for the fact that there's a possibility that everybody's been doing it throughout America now, it's like there's some sort of tax relief when we go to do taxes that we're homeowners and such.
Yep. Great question. Appreciate it, Joseph.
Yeah, thank you, Joseph. Look, everyone is tightening their belts. Everyone is feeling the pinch. Schools have been closed, but kids are still being instructed by their teachers through distance learning, and so we've still been paying our teachers. We've still been paying for schooling. We don't know when they're going to reopen, but we are going to continue to educate our kids, and that's going to continue to cost money. The problem is that because the economy has been pretty much shut down, tax revenues going to your local municipality, to your county, to the state of New Jersey are going to be severely down in the next few months. And so we have to figure out a way to make that up for people. That's why we're trying to get relief from the federal government. City of Phillipsburg has to balance its budget. Warren County has to balance its budget. The state of New Jersey has to balance its budget. So they can't do this without some help from the feds, and that's what I'm fighting for. And then for the individual taxpayer, there has been some municipalities have deferred property tax payments. Those are still going to be owed to the municipality. And so one of the things we did in the HEROES Act, which passed the House, is to provide some money for the state to give individual mortgage holders and renters relief. So there's some rent relief and mortgage relief in the HEROES Act that we passed. And again, hoping to get the U.S. Senate and the President to get on board with that because we really need it.
Thank you, Congressman. And thank you, Joseph. Appreciate your question. Thanks very much. We've got a good one here for Mike. This one's coming from Cassandra. She's in North Plainfield and wants me to read this question. As a public school teacher, I'm wondering what the plan is for opening school in the fall. Mike, we've gotten a few of those questions. You mind taking that on?
Sure. Thanks, Cassandra. Right now, the Commissioner of Education is working with all the county superintendents and by extension, local superintendents in developing a best practices plan. Some of the things we're working through on that, class sizes, distancing within classrooms, any sort of protective equipment in classrooms, cleanliness of the buildings, looking at and preparing for a potential second wave, which the Congressman sort of mentioned. None of us want to happen. We want to make sure we close down once, we open up once, and we're moving forward. But these are all things that have to be in any sort of contingency plan. So as we work through those over the next month or two, in order to prepare for a September opening date, the protection of the students and the protection of the teachers are of the utmost importance, making sure that folks are not coming to school sick, whether they're a teacher or a student. Things of that nature are kind of what the Commissioner of Education is taking the lead on. I think we're probably going to get our first report back in on that topic in the next week or two. So as we move forward, I anticipate the governor will be sharing results of those conversations at his daily press briefings. But as of right now, it's in a very preliminary stage, but those are the kind of things we're talking about.
Thanks again, Mike. Thank you, Cassandra. And we've got Miyoko live next from Long Valley. Miyoko, what's your question?
I actually have two, and I hope you don't mind. But the first one is, when we talked about anyone who wants to be tested for COVID can be tested and can be retested, my question is, currently it takes a doctor's prescription to become tested. Is that going to be the same for that case?
Mike, can you take that one off?
Sure. So listen, I think that, for example, there's 2 FEMA testing sites in PNC Bank, which is in Monmouth County, and Paramus at Bergen Community College, where you don't need a doctor's note. I can't speak to every testing site, but I think to the congressman's point from earlier, where he gently corrected me, is that we have over the last 2 to 3 weeks ramped up testing and made it more accessible to everybody, but there's still some way to go. That being said, I don't anticipate going forward, and the more forward we go, there needing to be a doctor's note to get tested. If that's the case now, depending on where you would get tested, living in Long Valley, I don't anticipate that being the case as we head into the future. That's probably the best way I can answer that question right now. And Congressman, feel free to, of course, correct me if you have a different opinion. But that's how we see it here at the state level.
Yeah. So where we are right now, Morris County, you still need, as far as I know, a prescription to go to the county site. Mm-hmm. Union County just opened up to people without a prescription. You just make an appointment, show up, and get tested. The next step has to be going beyond these county sites, where you can go to your local Rite Aid and just get a test there. Maybe, again, you call ahead to get an appointment, but you don't need a prescription. We already have the Walmart in Flemington where you can do that. Again, that's just one Walmart in Flemington. We got to have a lot more than just that. Yep. And what we're all working together to do is to get to the point where this is just really easy. If you feel you need to get a test, you don't have to drive all the way to Paramus, right? You can just go somewhere near where you live or near where you work, get tested, and have that assurance that you need, that you can go out and do stuff and then do it again, right? There may be employers who will ask their employees to get tested every couple of weeks. We may be doing that in schools, but we need to have enough tests available for that kind of system to be possible. And again, as with everything, state can't do it alone. You need help from the federal government, and Congress has provided a lot, but we need to do a lot more, and that's what I'm fighting for.
Yep. And just to close that up, Congressman, if you don't mind, one thing that we are exploring, and something in one of those calls I mentioned earlier I'm going to be on this week, is taking testing to the people, mobile testing. So having a mobile testing site where the testing site essentially comes to municipalities. Not fully baked yet. Obviously, there's still a lot of things to work through, but that's something I think that will help greatly expand accessibility to testing around the state. So that's something we're looking forward to trying to deploy in the next week or two and really start bringing testing to neighborhoods, to towns directly, so it's much more accessible and easier for people to get tested if they want or need to get tested.
Thank you again. Great answers. Appreciate you. Thank you, Miyoko. Let's get our next one in here from Maureen in Hampton. Looks like a good one for the Congressman. Hey, Maureen. Thank you for waiting.
Hi. Thanks for taking my call. I'm a self-employed person, and I did all the steps, for the PUA. I had read on the website you have to give your tax returns in order to qualify for the maximum benefit of $713 per week, because it's just giving me the $231 per week. So I finally got a hold of a person. It took me weeks, but I got somebody on unemployment, and the person, I don't know if they were misinformed, but they told me as a self-employed person, I wasn't eligible. I was only eligible for the $231. I tried saying it doesn't say that on your website, but I guess my question is, how do I get to a person who I can give my tax return information? I did file an appeal, but I don't know if that's the way to go because I don't know what the steps are. I
think you did the right thing there. I had a couple of these cases actually today that came across my desk. And what the Department of Labor is trying to do is get you the 231 so you have something right away, and while that appeal process goes forward. But if you would like, folks in the congressman's office know how to get a hold of me and know my email address. So if you want to send in to the congressman's office your details, I'm more than happy to take your case to the Department of Labor myself. So, we're trying to work through that, but the thought is get the 231 to you right away while we parse through all the details of your tax return and all the details we need.
Yeah, that's right. And we've handled a lot of cases like that. They're trying to get you the 231 just to get you something, and also remember you qualify for the $600 federal supplement as well, and then we'll figure out how much more you're owed. And again, please feel free if you want to leave your information with us after the call. There'll be a way to do that on voicemail for everybody who stays on the call. We'd be happy to make those connections for you.
Thank you, Congressman. Thank you, Mike. And thank you, Maureen. We're going to make a last call here for emails. If you'd like to get email updates from Congressman Malinowski's office, now's your opportunity to press 7 and do that. We just cleared that queue. So thank you to everybody who's already submitted your email address. We'll make sure to get you those email updates moving forward. If you'd like to get email updates from Congressman Malinowski, go ahead and press 7 on your phone. We'll do our best to get your email address and make sure we get you those updates moving forward. Let's get our next question coming live from Carol in Bedford. Looks like a good one for Mike. Hey, Carol.
Hi. Thank you so much for taking my call, and thank you for the town hall. My question is understanding that, the businesses were trying to get everybody open as quickly as possible, but where you have a business that may be like in a particular phase, like, a tailoring shop actually is the example, where I guess that would be in a phase 2. Are they required to open, or is it there's some discretion to the business owner simply because, in a haircut you can kind of go most of the time a little further away and things, whereas a tailoring you're right against people and handling the clothes afterward and everything. So is there discretion given to the business owner if they feel it's not safe to open yet, or are the businesses supposed to be reopening according to phase regardless?
So the short answer is no business is mandated to open if we allow them to open. But in a little more detail, you mentioned a hair salon, right, ma'am?
Sorry, what, sir?
You mentioned hair salons as a business, the business that...
Right. Hair salons are in phase 2, so like with personal care. So I was trying to figure out, like, the question, like my mother-in-law has a tailoring shop.
Gotcha.
But, that is going to be, I think, healing is such a different thing, and a lot of times they lump the tailoring shops as a personal care, but here sometimes if you have to pin a wedding gown, you could be spending 10-15 minutes right under somebody's chin.
Yep.
And so, the question is, you don't want to be in a situation where they're not eligible for CUA because their phase has hit, but it's not safe to reopen.
Yeah, so that's a good question when you add the nuance in there. If you refuse to reopen, you're still eligible for PUA. I'm not sure of that answer off the top of my head. However, you're not mandated to open by state law. That being said, it's the same thing with restaurants. Some of the pushback we've gotten for restaurants, outdoor dining, everyone's sort of focusing on because the weather's nice and it's able to happen. When it comes to limited capacity indoor dining, for example, if we decide that indoor dining can happen at 25 or 50%, well, for some restaurants, that won't make any sense to open because they're not going to make money. They can't predict how many customers they're going to get because of consumer confidence, et cetera. So no one's mandated to open. It's just the ability, if they would like to open, for them to be able to open safely and under the guidelines that they're allowed to open. So in the case of your mother in the tailoring shop, if she doesn't feel comfortable opening or only wants to open by appointment, or whatever she would like to do, as long as it's in the guidelines that we lay out, she'd be able to open, but she should be able to open as she sees fit and as she sees comfortable as the business owner.
Thanks again, Mike.
Yeah,
Thank you, Carol.
It's actually
go ahead, Congressman.
It's a really good and important question because we need to be reminded that the reason the economy is shut down is not just because Governor Phil Murphy issued an order. Most people had stopped going out to restaurants before Governor Murphy and other governors closed the restaurants because we want to be safe. Not every business wants to stay open when staying open means endangering the lives of their employees and their customers. And one of the things that the orders allowed for was for every business to know, okay, we can do the right thing. We can shut down without having to worry about other businesses like us staying open and, just competing with us in that way. Every business understood that it could confidently shut down, knowing that, if you're a restaurant, you shut down, every other restaurant is shutting down. If you're a tailor shop, every other tailor shop is shutting down. So, this is why we have to be very, very careful opening up. It's not just it's for everybody, including for the business owners who have very good reason to be cautious. And if there's any business owner out there who feels like they do need to stay closed and they're wondering about PUA for their employees or the Paycheck Protection Program, the small business loans, under those circumstances, come to my office and we will be your advocates. We will fight to make sure that you can still do what you believe is safe and still do right by your employees.
Thank you again, Congressman. Thank you, Carol. And our next one's here from Heather in Warren, who's asking, what can the House of Representatives do to make sure we can safely vote in November? Vote by mail is not permitted in every state. That one's from Heather. Congressman, can you take that?
Yeah, thank you so much, Heather. Super important question. In New Jersey, everybody can vote by mail. That's a good thing, but we still need to make sure that we can handle everybody voting by mail, or at least many more people voting by mail than we've had in past elections. So that's going to require a lot of work by our county clerks and by the state government and some help from Washington. The CARES Act, which we passed a while back, provides several $million for New Jersey to help improve our election systems for that purpose. There's even more money in the HEROES Act, so hopefully we can get our state government the help it needs to make sure we can all vote safely. Meanwhile, for the rest of the country, there's some states that don't allow everybody to vote by mail, and some of them are trying to make it easier. President has been very, very critical, President Trump, of vote by mail the last few days, and I don't quite get it because there are a bunch of states like Utah and Washington and Oregon, Colorado, where everybody votes by mail in every single election, and it works absolutely great. We do not ever want to see anywhere in America a situation like what we saw during the primary in Wisconsin a few weeks ago, where people were basically told to choose between their right to vote and their right to life. That can never happen again. And so in the HEROES Act, we require every state in the country to allow everybody to vote by mail, and we give them assistance, financial assistance, to help them make that transition. I'm fighting really hard to get that done. I don't care if you're Republican, Democrat, Independent. I want you to be able to vote safely this November.
Just to add on to that point, some of the things we've done in New Jersey just for this July 7th primary. We moved, obviously, the primary date back from June to July. For the July 7th primary, we're allowing every county to have up to, or at least rather, 5 polling drop box locations. Also going to be allowing counting the vote by mail for up to 7 days, when it's usually 48 hours. Mandating that every municipality has at least 1 polling location. So we're trying to make voting as accessible and safe for everyone as possible here in New Jersey. That's all I can really answer for. But I just wanted to make that clear that we did make a couple of amendments to the July 7th primary already. And as November gets closer, post-July 7th, we'll obviously be seeing how those things worked and seeing, number one, if we maintain that for the November election, and and or take even more measures into account.
Thank you again. Appreciate those answers, and thank you very much, Heather, for the question. We are just about out of time, but we're going to get one more question in here, and I'm also going to let everybody know that if you didn't get a chance to get your question answered live today, when we get to the end of the forum in about 5 minutes, you'll have an opportunity to leave us a voicemail message with any additional questions or concerns or issues that you need help with. And if you need someone with the Congressman's office, make sure when you leave those voicemail messages at the end of the call that you also leave your name and your phone number so we can reach back out to you. Likewise, if we didn't get your email address, feel free to leave those in a voicemail, although we'll keep collecting emails. We've got 28 people who are still waiting to give us their email address for updates, and we're going to do our best to get those email addresses and get you updates in these next 5 minutes here, so stay tuned. Let's get one more question out here from Gina Marie in Cranford, and I think both of you will probably weigh in on it. This question is, what's going to be done if our community spread starts getting bad again due to opening things back up? Also, how are we going to make sure people wear a mask, and how will that be enforced? So, Congressman, could you start in on that, and then maybe we can hear from Mike after that?
Thanks. And that's a really good and important question to end things with. To this point, I have to say we should all be inspired by the degree to which so many people in New Jersey and across the country have been willing to sacrifice for the greater good, willing to stay home, willing to shut down their businesses, willing to restrict their movements. It's not easy. A lot of economic pain has been accepted and suffered because we've decided to do those things, but we've saved a lot of lives. So, I have faith that most of our fellow New Jerseyans are going to be smart going forward. Yes, people want to go to the beach. Yes, they want to go outside. Yes, we want to restart the economy because we can't stay at home forever. But I think most of us understand that we still have to practice social distancing, that we still should be wearing a mask when we're out with other people, not to just protect ourselves, but mostly to protect others. So, even if you think, you're fine, even if you think you can't get it, please wear a mask for other folks. How does that enforced? Well, we're all going to have to not only try to follow the rules ourselves, but remind everybody around us to do that. There is no pressure better than social pressure. Walking into a store and seeing somebody without a mask and asking them politely to put it on. Asking them, to do the right thing and not to have to wait for the police to be taken away from other duties protecting us, to be able to deal with some jerk who's trying to defy the orders on wearing masks, which, by the way, are not just coming from the governor, they're coming from the business owners who want their employees and their customers to be safe. So, a short answer, who does this? We all do this. We all have a responsibility. We all have a duty because we only want to have to go through this once. We don't want to have to go back in the fall and in the winter to an economy that's shut down, hospitals that are breaking under the pressure of COVID-19 patients. Mike, do you want to add anything?
Sure. I think, the governor said at many of his press conferences, the whole reason we are being as cautious as we're being, and to the congressman's point, the vast majority of New Jerseyans have been following the orders diligently, and that's why we have the numbers as low as we have them. But the governor has stated that if the numbers spike up, then we're going to have to try to pull back. It's not something any of us want to do. That being said, we when it comes to requirement of masks, to the congressman's point, I think you're going to see as we open up whenever, in the coming future, in the near future, when we open up indoor spaces, that's going to be something we look at very heavily. It's very tough to police mandating masks in outdoor spaces, but in indoor spaces, that's something we're looking at very intently.
Thank you again. Appreciate it, Mike. Thank you, Congressman. And thank you for that last question from Gina Marie. We're just about to wrap up, but again, if you have any questions, concerns, issues you need assistance with, you can stay on the line as we wrap up. Make sure you leave your name and contact information in addition to your issue or concern. When we get to the end of the call, leave those voicemails, and we'll make sure to call you back as long as you leave that contact info and the nature of your problem. And with that, I'll turn it back over to your Congressman, Tom Malinowski, to take us to the close. Go ahead, please.
Thank you, everybody, again. Thank you, Mike, so much for joining us for what I hope has been an informative hour for our constituents. We've been through something terrible in New Jersey and in the country, but we have come together as one people to defeat it. We are proving in New Jersey that through responsible policies, responsible action, not just by our government, but all our citizens, we can save lives. We can defeat this horrible disease. Please, let's stay patient. Let's stay on track, because as I've said again and again, we don't want to have to go through this again in the fall and the winter. It is worth it. Meanwhile, I know a lot of folks have been experiencing specific problems. We've heard about some of them with unemployment, with the small business loans, with other aspects of our relief effort. My team is working around the clock to try to help folks with those issues. So if you have any need for help or any questions about what's being done, please feel free to leave your information after the call on the voicemail, and someone will get back to you. With that, thank you again, and I'm looking forward to our next opportunity to continue this discussion.